Welcome to Facts TV News, where everything is true. Thompson Hero withdraws from Birmingham Diamond League. Five-time Olympic champion Elaine Thompson Hero is out of Saturday's Diamond League meet in Birmingham, England. A release yesterday from Andy Sport Management, the athlete's agent said Thompson Hero decided not to travel to Birmingham out of an abundance of caution after she experienced some discomfort in training. The release said that Thompson Hero is looking forward to resuming in 2022 competition schedule in short order. Slain brothers to be buried together. As relatives of Devon and Orville Ellis prepare to lay them to rest on May 26, they cannot help but wonder why a gunman abruptly cut the two brothers' lives short. Their grief is that much harder to bear as the men, 60 and 45 respectively, were killed only 7 months after their elder brother, Bernard Ellis, died after being diagnosed with COVID-19. They were fine, hard-working guys. They were not troublemakers, said a close relative, whose name is being withheld for security reasons. The brothers were shot in Gales District on the night of March 21. They had just eaten dinner and were relaxing inside Devon's house when a man walked in and shot them multiple times. Orville died 2 days later. Devon hung on for another 3 days before he too succumbed to his injuries. The shooter remains at large. Words cannot express how the family is feeling right now, the relative of the slain men told reporters on Wednesday. We are distraught. We are very, very distraught. The brothers were participants of the government's overseas employment program, working seasonally on farms in the United States. They didn't even live to enjoy the fruit of their labor. They just built their little house and were just about to try and relax now, but somebody just came and took their lives away like that, the family member lamented. They didn't leave another company. They were very close. Their final resting place will be beside each other in the district. Saharan dust cloud impacting Jamaica. Jamaicans are being urged to exercise heightened vigilance and care during the passage of the Sahara dust plume, now affecting the island. Its impact on Jamaica is expected to gradually increase into the weekend, being most concentrated on Saturday and Sunday, and then decrease during the start of the next week as it drifts towards the northwest. Saharan dust originating over the northern Africa and sometimes impacting weather conditions over diverse locations of the world currently extends from the tropical Atlantic into the Caribbean region. This is especially common during the period of May to August annually. Over the past 72 hours, a fairly large plume of dust has been observed via satellite to be moving over the eastern Caribbean and into the central parts of the basin. It is projected that the impact of the Caribbean is likely to remain for another few days until about Tuesday of next week. The Ministry and the Met Service are aware of the increased number of Jamaicans who are now affected with respiratory difficulties as a result of the ongoing COVID-19 pandemic. We are therefore urging the continued wearing of masks to mitigate the effects of the dust plume as well as offering the best defense to the resurgent COVID-19 disease and also staying indoors where possible, said Minister without portfolio in the Ministry of Economic Growth and Job Creation, Senator Matty Samuda. Jamaicans are also being urged to cover outdoor water supplies, particularly those who engage in rainfall harvesting, as the dust may impact the quality of the water. The Saharan dust is categorized by hazy condition and usually results in stable air with reduced rainfall activity. This spike in airborne microparticles is known to aggravate health issues, particularly respiratory illnesses, including asthma. Conditions associated with this episode of Saharan dust are not expected to be severe, however, the Meteorological Service will continue to monitor its development and progress. Black River High School mourns loss of teacher. The Black River High School in St. Elizabeth has been plunged into mourning following the death of business teacher Amori Tomlinson. School principal Christopher Romans told reporters that Tomlinson, who was an educator at the institution for over a decade, had been ailing for some time and had to be hospitalized at one point. Describing Tomlinson as a jovial educator, Romans said the staff at the institution will now have to find ways to cope with the tremendous loss of their colleague. She did an operation just at the onset of COVID-19 pandemic. Before she went in hospital, we had dialogue because this was a recurrent situation, he said. We are going to see how we can deal with the loss together as a school family. She was a very jovial person. Tomlinson is believed to be the 8th educator to die in as many days. Earlier on Wednesday, Vice Principal of Claremont High School in St. Catherine, Jennifer Giddens, died on her way to hospital. 6 more educators also died over the period of 8 days. COVID-19 cases in schools not resulting in hospitalization. Health and education authorities are emphasizing that the severity of COVID-19 cases among students is in keeping with the global trend, and that while some schools have opted to return to remote learning, for some students, cases generally are not resulting in hospitalization and death. Education Minister Favor Williams advised on Wednesday that for the first week in May, there were 22 confirmed cases of COVID-19 among students, while 7 teachers tested positive and 1 independent school reported a positive case. In the week of May 9, there were reports of 617 suspected cases among students and teachers, with 446 of suspected cases among students, who turned up 136 positive tests for COVID-19, while 105 out of 160 suspected cases among teachers tested positive. Independent schools reported 4 positives out of 11 suspected cases. Williams said some schools have returned to remote learning for some students due to COVID cases among the students and teachers. These include Woolmer's Boy, Calabar, Westwood and Manchester High School and Kingston College. We are working to ensure that exempt students who tested positive are still able to do their tests, and we will give our school guidance as quickly as we can on that matter, she advised. 5,000 COVID test kits were issued to island close to 1,000 schools for the resumption of face-to-face classes. Williams advised that additional kits are to be distributed. The WHO Technical Advisory Group on Safe School during the novel coronavirus pandemic recommended at its 8th meeting in January that systematic serial testing of children and staff for the early detection of pre-asymptomatic cases may be considered when there are clusters of people with confirmed cases of COVID-19. The ministry also noted that included in the upward creeping COVID-19 hospitalizations are children. Director of Health Services Planning at the Health Ministry, Dr. Nadine Williams, highlighted a slight uptick in those numbers between April 25th and May 15, with 9 children in hospital. Health Minister Dr. Christopher Tufton also stressed the importance of students returning to physical classes despite the associated risk. He said face-to-face classes represent a vulnerable space as the country undergoes a 5th wave of COVID-19 infection. To keep our children out of school beyond 2 years that they were out has been a liberating effect that is far more intense than those being out of school environment even at the risk of contracting COVID. While we are having cases in the schools, we are not seeing cases that are severe to the point of hospitalization or death. And that is a normal trend globally, he stated. In the meantime, Chief Medical Officer Dr. Jacqueline Bisosa McKenzie said the government is still trying to procure vaccine formulated for children ages 5 to 11 and so far has positive indications from United Kingdom and Spain. We don't have a specific time on when these would arrive in the country. We were not able to update the country yet as to when we would start the vaccination. However, we are also in negotiations concerning these vaccines, she said. New COVID-19 fear. As the novel coronavirus pandemic continues in its 3rd year, hundreds of thousands of survivors of the disease continue to suffer with lingering pain symptoms and conditions. Technical consultant for Incident Management System for the Pan American Health Organization, PAHO COVID response, Dr. Sasha, studies and data from public health agencies are that incidence of post-COVID symptoms range from 10 to 60% or more of people who had the disease. The varied percentages may be due to the heterogeneity of the study. It may also be due to the definition that these studies have been using to recognize patients with post-COVID. Also, early on the studies did underestimate the incidence since this condition was not well recognized and communities are now just starting to do the research, Dr. Sasha explained on Monday at a webinar titled The Many Faces of Long COVID-19. The webinar was held in collaboration with the University of the West Indies and focused on the medical long-term impact of COVID-19, including mental health, case management, and rehabilitation. Dr. Sasha noted that since 2020, the medical community has raised concerns about the possible medium to long-term effects of COVID-19, and now in the third year, these concerns are very real, with many published literature linking to the long-term conditions with SARS-CoV-2 infection, now termed post-COVID-19 conditions, by the World Health Organization (WHO), also referred to as long COVID, long haulers, and other names by the French research institutes. The WHO has developed a standardized clinical case definition for long COVID based on global stakeholders' consensus. This is now defined as individuals with a history of probable or confirmed SARS-CoV-2 infection, usually 3 months from the onset to acute infection with symptoms that last for at least 2 months, which cannot be explained by alternative diagnosis, Dr. Sasha pointed out. Presently, more than 200 symptoms have been associated with long COVID, ranging from mild to debilitating, affecting every major organ system. The most commonly recorded symptoms are fatigue, shortness of breath, and brain fog. In studies, people report that even 2 years post-COVID, these symptoms have prevented them from returning to normal functions, such as work and school. The technical expert noted that post-COVID can affect individuals who were asymptomatic and those who had mild, moderate, or critical disease. Dr. Sasha said 200 studies with more than 120,000 participants found a 57% incidence of any post-COVID symptoms 6 months from the onset of the disease, not linked to the severity of the person's illness. She pointed to a study published in The Lancet this month, one of the longest longitudinal studies of COVID survivors, following more than 1,000 patients for 2 years. It found that 6 months, 68% of survivors had at least one sequel, and that there was many a slight decrease, down to 55%, of at least one symptom, all the way through 2 years post-acute infection. What it shows you is that even 2 years down the line after acute infection, there is more than half of patients still having symptoms, she noted, adding that this has been associated with decreased quality of life for these sufferers. At the same time, PAHO says there is evidence that the COVID-19 vaccine could have protected effects against post-COVID conditions. Dr. Sasha stressed that as there is no single diagnostic tool for long COVID, which means patients must undergo a comprehensive system of care to treat and manage their symptoms. She noted that PAHO has been supporting countries in the region to implement care models for post-COVID conditions, which include a primary care pathway, access to multidisciplinary rehabilitation, and specialized medical services, focusing on both hospitalized and non-hospitalized patients. Please remember to subscribe, like, share, and click the notification bell for daily updates.